Hello to everyone gathered here tonight. I am so saddened that I'm unable to join you tonight, but I am thrilled to acknowledge and celebrate the work that the Proudford family continues to accomplish. The families that so bravely face and still thrive against sickle cell every day, and the people and organizations fighting on behalf of those families to find treatments and cures and the hope for a future without sickle cell disease the way we know it today. With that, it is my honor to introduce Dr. Ted Love, tonight's Distinguished Service Award winner. Dr. Love is a distinguished industry leader with more than 2 decades of management experience, along with nearly a decade of prior experience as a practicing physician. He has spent much of his career focused on addressing the ongoing health disparities facing the sickle cell disease community and leading the development of therapies for this underserved patient population. He is now the new board chair for Biotechnology Innovation Organization, the largest advocacy organization in the world for companies in the biotechnology space. He is the prior president and CEO of Global Blood Therapeutics, responsible for creating a sickle cell drug that helped to end a 20-year drought in the development of treatments for sickle cell disease. I could just go on and on and on about all that he has done, but we should just jump into this conversation with Dr. Love. So good to speak with you.
It's a pleasure, Patrice, to meet you and to speak with you.
Okay, so your resume, indeed impressive. I've read a lot about you and your work, but I have to say one of the things that impressed me the most was that after years of being a leader and making a difference for so many patients across so many companies, you retired. You wanted to spend time with your family, your wife and your daughters. But then you found that you had a passion for this sickle cell work and you wanted to get back into it. So that meant you had to go to your wife and your daughters and tell them. Now, my dad is a girl dad, and among the 4 women, he doesn't always win a lot of the arguments, but it was obvious that your family knew this was something that you had to do. So to me, that speaks volumes about your dedication to this work. So let's talk about your connection to sickle cell disease and making a difference for families.
Well, as you said, I had retired and had a very long and fortunately very successful career. But the opportunity to do something for sickle cell patients was very special to me. I kind of thought back to my days in medical school and when I was at Yale and later when I was at Harvard at the Mass General, seeing sickle cell patients and just seeing how the patients had very few options and quite frankly, how they were treated in the hospital. I felt that was an indignity and I felt it was really a moral imperative for someone to try to do something about it. So when I was asked to run this company, which Third Rock Ventures started with $50 million, and I saw the science, I really said, Patrice, this is something that I personally need to try to do to make sure that the odds of success for sickle cell patients is maximized. And as you know, we came about this approach, very, very sophisticated approach to sickle cell disease, really with the idea that we could cure sickle cell disease with a simple daily pill. And as you know, that effort moved very quickly through the FDA and was approved in 2019 and is available to patients in the United States and now increasingly around the world under the marketing and the work of Pfizer.
So talk about the process, because again, we said that there was a 20-year lull in being able to get something like this out to market. So talk about the process from the conception of, hey, this is what I think will work. This is what we're seeing with sickle cell patients. This can help reverse that. How it works and what that whole process was like.
Well, it's actually a very elegant story. We understood sickle cell disease as a single point mutation, a genetic disorder, really before we just understood any of the genetic disorders. What we also learned about sickle cell disease is that the hemoglobin, which is the protein inside of the red cells that has the sickle mutation, the hemoglobin behaves normally as long as it has a single oxygen still stuck to it. Hemoglobin carries oxygen throughout the body. And what we were trying to do was very straightforward. If we could modify the sickle hemoglobin to make it prefer to hold on to at least one of the four oxygens that it carries, it would not stick together in this way that causes the cells to sickle. And we made thousands and thousands of molecules. We tested them to see if they actually stop the hemoglobin from sticking together. We obviously tested them to make sure that these molecules appeared to be safe. We moved into humans in 2015, at first normal humans without sickle cell disease, just to prove that it would be safe in individuals without sickle cell disease. And then we moved into patients with sickle cell disease, and we could see immediately that the sickling was stopping. The red cells were normalizing, and since that really is the fundamental basis of sickle cell disease, we knew we were onto something very important in terms of attacking the fundamental nature of the disease. I say to people all the time that in the early days of HIV, we were treating the infections that people get because they're immunocompromised. But ultimately, we began to treat the virus that was causing patients to be immunocompromised. And that's how we've had the great breakthrough. And that's why people with HIV no longer really die of HIV if they take their medicines. We were taking the same kind of approach to sickle cell disease to see if we could stop the first event in the disease to try to prevent all of the downstream complications. And while it's early, I think our second generation drug that we've made now after Oxbryta can actually stop the polymerization so completely that we could turn patients really into looking like they don't have sickle cell disease. The first therapy, Oxbryta, is very, very powerful and very helpful and really ameliorates the symptoms, but it probably doesn't get most patients to a level that I would call curative. The second generation drug, we expect to potentially get to that level, and that will be coming later. But right now, Oxbryta really was the biggest advance that we had had in sickle cell disease.
Which is amazing. Listening to how you're describing all of this is amazing. What was it like for you and your team when you knew, the moment that you know, this is it, we have found it, we have done what we were trying to do, and this is going to make a difference?
Well, it was the first 6 patients. We actually, as I said, treated people without sickle cell disease first to make sure there were no side effects that we could see. And then we treated 8 patients, actually, 2 with placebo dummy drug and 6 with actual drug. And the data was so exciting from those first 6 patients that we actually listed the company on the NASDAQ market, raised much more money so that we could do the clinical trials around the world to get the therapy approved. We ultimately, Patrice, raised $1.5 billion. We became the largest investor in finding a sickle cell solution in the world, and that includes the U.S. government.
And in that process, you and your team were committed to working closely with the patients and with the community. There was a relationship there, and that indeed, in fact, has changed the way the biotechnology industry looks at the patients that they will ultimately create these medicines and treatments for. But that meant a lot to you and your team.
We loved working with the sickle cell community. In fact, I think the mantra at GBT was, it's not about me, it's not about you, it's about the sickle cell patient. And everything we did at the company focused on that, and that made it easy for us to get through difficult times. It made it easy for us to get through challenging periods because we really did have the mantra, we cannot fail. We've got to succeed for patients. And we also said we've got to move very quickly because patients need the help. Patients are dying from sickle cell, and we need to do something about that. So that focus on the patient was real at GBT. I think the patients know it was real, and everyone in the company knew that was our commitment.
Others are studying sickle cell as well. You know, you guys are leading the charge with what you're doing. But you say if there are multiple options for treatments, then that's just a win-win. There's room for everybody to work on this.
That's exactly the way we've always felt. In fact, it wasn't even about GBT. I mean, I said it wasn't about me or you. We felt that our company existed to focus on solutions for the patient. And we stimulated, as you said, Patrice, other companies to be created, other companies to be funded to work on sickle cell disease. And my hope and desire is that that continues. I'm very excited about our therapies because we knew sickle cell is a global disease, and we wanted to make therapies that were simple and accessible in the form of a daily pill that we could transport all around the world and help sickle cell patients in the U.S., but also in Africa and India and South America, poor countries where the resources are very limited, but we felt we could make a breakthrough for them.
Are you seeing perceptions change about people living with sickle cell? Because we've heard stories where, you know, you go into an emergency room and you don't get the help that you need. They don't understand what you're going through. They think you're looking for something else. Or even to one thing I read that said, you know, this is an African-American disease, so African-Americans should figure it out. We don't have the answers for you. What are you seeing along those lines?
You know, I've heard that line too, that this is an African-American problem and we should figure it out ourselves. And in many ways, GPT was a company that was composed of people of very diverse backgrounds, and we were focused on figuring it out for these patients. I do think that perceptions are going to change. I can remember when I was very early in my medical training, and we had very limited treatments for depression. And there was a lot more stigma associated with depression, in part because we couldn't do anything about it, and the patients were coming in and we didn't really have anything to provide them. That was kind of the case in sickle cell disease. And as you said, Patrice, that is changing. Doctors, nurses, healthcare providers are going to have exciting options. Patients are going to have highly effective, safe therapies to try, and that's going to stimulate more investment in sickle cell disease. So I think GBT was leading a wave of change for sickle cell.
And Dr. Love, talk about the importance of what the William E. Proudford Foundation is doing and has done.
Karen Proudford is one of the first people I met. I met Karen when we were starting the company. We didn't have a therapy. We didn't have any clinical studies. But we were trying to get out into the community and find out who in the community we should really develop a relationship. And when I met Karen Proudford, it was very clear that this was a family which was very sophisticated, very committed to helping sickle cell patients. And we wanted to be in a partnership with them. So we struck up a partnership with Karen Proudford, with the foundation, with other organizations around the country, because that was really critical. We needed their help to be successful, and we were very fortunate to have the support of the Proudford Foundation.
And just lastly for you, what is your hope and belief about the future as it relates to sickle cell disease?
My hope is that people no longer die from sickle cell disease. I think we really are on the brink of being able to diagnose the disease early, have children begin on these highly effective, simple oral pills every day. There'll be a liquid formulation for children, for babies, and they never get sick. I think that is entirely possible, and I predict that will be the future of sickle cell disease within the next 10 years.
Dr. Love, it has been an absolute pleasure speaking with you. I thank you for all that you do. Your recognition tonight is well deserved.
Thank you, Patrice.